Welcome this afternoon. I wanted to talk to you a little bit about toothbrushing procedure. That's to be differentiated from toothbrush technique. There are different toothbrushing techniques that you probably have heard about before. The Stillman is one, and modified Bass. Basically what we're talking about there is the way that you use the toothbrush to brush the teeth. There are some that contend that you would use a downward motion on the bristles and leaving the brush at 45-degree angle. The other one allows you to use a semicircular motion, again keeping the brush at a 45-degree angle. That refers specifically to the toothbrushing technique itself. What I wanted to address was the whole procedure in doing toothbrushing. Now when you brush the teeth, normally you will have 32 teeth if you have all of your teeth, including the wisdom teeth. Most times people have their wisdom teeth extracted, so you'll be dealing usually with 28 teeth. The thing to remember, what I usually tell people, is that you have three surfaces of the tooth that you need to brush. You have your outside surface, you have your chewing surface, and then you have your inside surface. Now remember that when you brush, you need to brush all three of the surfaces. Usually what I suggest when you're doing the brushing, if you always start on the upper right, on the outside surface, with the brush again at a 45-degree angle, regardless of the technique, whether it's modified Bass or Stillman, what you'll find is that you go through and you brush all of the outside surfaces first and proceed and complete that. What happens then is you go back through and make another pass and brush all of the chewing surfaces and go through and brush those. And then finally you go in and brush the inside surfaces of the teeth. What happens there is you make three passes through the mouth. You allow for brushing of all of the surfaces and you ensure that you have a fairly clean dentition. Some of the concerns, obviously one of the reasons why you start from the outside and then work your way to the inside is that in most people the gag reflex is initiated either by the soft palate or down under the tongue, sublingual on the lower. And by starting on the outside, if they have an exaggerated gag reflex, you'll find that by doing it that way, the gag reflex will be less tendency, and they'll have less of a tendency to gag as they proceed with brushing. Now, one of the other things with toothbrushing that I would suggest is, again, if you have a child or somebody where you're involved in doing their oral care and you want to do the toothbrushing for them, there's basically two different approaches that you can take. One is a direct face-to-face approach where you're looking at them directly, and the other technique is to normally approach them at 11 degrees with them sitting in front of you. And if you're at 11 o'clock when you do that, what happens, the reason why you do that is that then when you're brushing their teeth, all of the hand movements that you're using are the same hand movements that you would be using otherwise when you're brushing your own teeth. The problem with a direct face-to-face approach is that a lot of times, particularly in the upper left area, you can't turn your wrist enough to be up there and to be able to brush it. Some of the things that you would want to be concerned with in doing the toothbrushing is if you see bleeding gums or gingivitis, that would be an indication that there's something that's not right with the teeth, and in that situation what you would want to do is explore further or see your dentist. Again, you may find other areas that are sensitive. A lot of times if you have cold sensitivity, that's usually related to the toothbrush contacting the root structure, because normally the root structure on the teeth, when you get recession, part of the root would be exposed here. And what happens in that situation is it allows for more sensitivity. And what you'll find is then when you do brush those areas, you'll tend to get sensitivity. That doesn't necessarily indicate a cavity or anything. It may be recession. The important thing, again, also with the procedure, ideally you want to do it at least twice a day. Obviously, there's no harm in doing it multiple times in brushing your teeth. The only other thing I would mention in finalizing it is that also as a part of oral care, flossing is important as well. Now the flossing, the purpose for the flossing is the brushing will get the outside surfaces, the chewing surfaces, and the inside surfaces. The problem you have is that you have areas in between the teeth, the interproximal spaces, and that's the purpose for the flossing, is that way you go in there and brush and clean those areas as well. The purpose for the brushing is primarily to dislodge the bacteria and the plaque that accumulate on the teeth. It normally takes teeth about 24 hours to accumulate the plaque, so that's why they suggest that you brush at least once a day, is so that you disturb that plaque and bacteria and eliminate any problems that you may have and keep a healthy mouth.